Robert Morris University School of Nursing and Health Sciences is pleased to present an interprofessional standardized patient simulation depicting a patient presenting to the primary care setting with the complaints of weight gain, fatigue, and bipolar disorder. The Access to Interprofessional Mental Health Education project is funded by a federal grant from the U.S. Department of Health and Human Services. The following video has been developed to model the integration of behavioral health in the primary care setting, with the overall goal of highlighting interprofessional collaboration. Objectives to consider while viewing the video include the history and physical examination, the mental status of the patient, differential diagnoses, diagnostic and laboratory tests, patient education, and patient treatment options. Critical thinking and reflection questions include, if this was your patient, what would you have done differently? What physical examination techniques were implemented? Was any part of the exam omitted? What are the differential diagnoses in a patient presenting with weight gain and fatigue? What labs and/or diagnostic tests should be ordered when a patient presents with weight gain and fatigue? How is bipolar 1 disorder differentiated from bipolar 2 disorder? What are symptoms seen in patients presenting with bipolar disorder? How do atypical antipsychotics compare in relation to causing weight gain and metabolic syndrome? What are the recommendations regarding lab monitoring in patients taking atypical antipsychotics?
Good morning.
Hi,
I'm Dr. Timmons, Dave Timmons.
I'm Abby. Nice to
Abby,
meet you.
It's nice to meet you. Welcome. What brings you in today?
I'm very worried about all the weight that I've gained in the past few months, and I feel very tired.
Okay. How much weight have you gained in the past few months?
About 20 pounds.
Okay. And has anything changed in your life in the past few months?
Just increased my appetite. I don't know, I'm just eating more.
Okay. Okay. Understandable. Does anything else bother you? Are you having any pains or any other discomforts?
I feel fatigued. I feel tired all the time, even though I'm sleeping much better.
Okay. Do you feel like you get a restful sleep at night?
Yeah, I could say that.
Okay. And do you snore at night?
I don't know. I never pay attention to it.
Do you live alone, or has anyone noticed that?
No, I live alone.
You live alone. Okay. Okay. Understandable. Has there been any changes in your diet over the past few months? Tell me a little bit about maybe how you eat in a day.
I eat when I can. Like I pack my lunch. I work in a high school, and so I have my lunch box. But sometimes it's so crazy that I skip some meals. But lately I've been just munching into stuff, like I'm just so hungry all the time.
Okay. Okay. Have you had any chest pain or breathing problems?
No.
No. Any constipation, or have you noticed any change in your bowel habits?
No, I go to the bathroom a lot because I've been drinking lots of water.
Okay.
I've been feeling thirsty all the time.
Okay. And that also has been a change over the past few months?
Yes.
Okay. Have you noticed dry skin or oily skin, any changes there?
No, not really.
No. Okay. When did you have your last period? Have they been regular through these last few months?
I think so. I don't keep track, but I'm pretty sure I got my period last month.
Okay, so you don't notice any major changes in your period?
No.
Okay, okay. Do you have any past medical history? Do you have other medical problems?
Yes, I do. I was diagnosed with bipolar disorder
Okay. When were you diagnosed with bipolar disorder?
about over a year ago.
Okay. And who treats you? Who prescribes medicines for your bipolar
It's
disorder?
Dr. March.
Okay. And do you see Dr. March on a regular basis?
Yes, monthly.
Okay. Has Dr. March changed any medicines in the past few months?
Yes, 3 months ago he switched meds on me. I'm on Seroquel.
Okay. And what were you on prior to that?
I think it was Risperdal or something, we got like a bunch of trials until we got this one right.
Okay. And has Seroquel been working for you?
Yes, yes.
Okay. But your symptoms of weight gain and fatigue, they've come on in correlation with you taking Seroquel.
Yeah.
Okay. Do you have any other past medical problems?
No.
No. Have you had surgeries in the past?
No.
Okay. Do you take any medicines besides Seroquel, even including vitamins or over-the-counter medicines?
I take Claritin because I have allergies.
Claritin on a daily basis?
It's more like whenever it's bothering me, I take it, like 10 milligrams over-the-counter Claritin.
Okay. And did you start taking Claritin in the last 3 months when you had these problems?
I've always taken that.
Okay, good. Are you allergic to any medicines?
Not that I'm aware of.
Okay. Do you have any family history of bipolar disorder or other illnesses?
Yes, my mom has bipolar disorder.
Okay. Anyone else in the family, brothers or sisters?
My father has a history of depression, and my mom also has high blood pressure.
Okay. Okay. Where do you live?
Near Churchill, Forest Hills area.
Okay. And who lives at home with you?
Just me.
You're by yourself. What do you do for a living?
I'm assistant, administrative assistant at a high school close by called Woodland Hills.
Great. Do you smoke?
No.
Drink alcohol?
Occasionally, like on the weekends, mostly wine.
Okay. 1 or 2 glasses of wine on the weekends, or much more than that?
More like 2 or 3.
2 or 3. Okay. Any drug use?
No.
No. Okay. How do you do with exercise?
Poorly. I haven't been exercising at all.
Okay. Did you in the past? Has there been a change in your exercise in the past 3 months, or has this been your normal?
For the past 2 years, this has been my normal.
Okay. Just a couple of other questions to be complete since we're first meeting you today. Are you up to date with pap smears and seeing your gynecologist?
Yes.
Yes. You've been there in the last year?
Yes.
Okay. Have you had a flu shot?
Yes.
Okay. Wonderful. I'm going to just stand up and take a listen to you if that's okay?
Absolutely.
Okay. And I'm just going to start by feeling your neck and your thyroid. And you can put your head down a little bit. Okay, great. And you just breathe normal while I listen to your heart. Okay, and if you could take a couple big breaths for me. Again. And 2 more. And again. Okay, and would you mind lying back for me, please? Thank you. And I just want to examine your belly.
That's okay.
Okay. Do you have any tenderness when I press on your belly here?
No.
And you had mentioned that you were peeing more frequently than usual. Does it burn or hurt at all?
No.
No. Okay. You can come on up for me.
Thank you.
And I just want to take a look at your feet real quick.
Okay.
Okay, I'm going to take your shoes off here. Okay. Do you feel me touching your feet evenly?
Yes.
Okay. Okay. Well, listen, I have some thoughts, and we're definitely going to help you today. But before we go through everything, I have a nurse practitioner who specializes in mental health, and I want her to have a chance to come in and talk to you for a few minutes. After that, I'll come back in, and we'll talk about what we're going to do to get you feeling better.
Good.
Okay?
Okay.
Okay, wonderful. We'll see you soon.
Okay.
Hi, Abby. I'm Kirsten Koenig. Nice to meet you.
Nice to meet you too.
I'm a mental health nurse practitioner, and Dr. Timmons wanted me to come in and talk with you a little bit this morning. Is that okay?
Okay.
Okay. So Dr. Timmons had said that you have some concerns with weight gain and feeling more tired recently. Is that correct?
Yes, that's
Okay.
correct.
How long have you been feeling that way?
For the past 3 months.
Past 3 months. Okay. Did he also shared that you're taking Seroquel? Correct?
Yes.
Okay.
Yes.
And when did you start Seroquel?
About 3 months ago, my
Okay.
doctor switched over the meds.
Okay.
Yes.
Do you know how many milligrams you're taking?
300.
Okay.
And it's once a day at bedtime.
Okay, so you're taking 300 milligrams at bedtime,
Yes.
and since that time you've been feeling a little bit more tired and you're hungrier, I heard.
Yes, but the funny thing is that I can sleep better. I sleep better, but
Okay.
I feel fatigued and tired all the time.
Okay, okay. Tell me how your mood's been recently.
It is, I should say, under control. It is under control. I feel better.
Okay, so you haven't had any really elevated high moods where people around you notice that, you were not acting like yourself, any racing thoughts or anything like that?
No, not recently, no.
Okay. When was the last time you had an experience like that where your mood was really elevated and you felt really, maybe didn't need a lot of sleep and had a lot of energy?
More like maybe 6 months ago.
Okay, so since you've been on the Seroquel, that you have not had any of that?
No, that's correct.
Okay. How about any times that you feel sad or down in the dumps? Any depression recently?
No, not really. I'm feeling concerned. I'm feeling worried about this weight gain. Like I got like 2 pounds on me that they don't belong to me. Like I
Okay.
just want to get rid of them.
Okay.
You know?
Okay. How much weight did you gain?
Like 20 pounds.
20 pounds. Okay.
Yeah.
Then that's concerning in a 3-month time frame.
Mm-hmm.
Okay. So you're anxious about this weight, I'm hearing.
Yes.
Okay. All right. Any problems with any type of suicidal thoughts over the past couple weeks?
No.
Okay. Any past history of a suicide attempt?
Yes. 2 years ago, almost 2 years ago, I had an episode. But it's over now. I'm good now.
Okay. Do you mind telling me a little bit what happened 2 years ago?
No, not at all. It's just I got really depressed, really in bad shape, and I overdosed. But I'm fine. I'm fine now.
Okay. Were you hospitalized at that time?
Yes.
Was that the only time you've ever been in a hospital
Yes.
for a mental health problem?
Yes.
Okay. So since then, 2 years ago, you haven't had any suicidal thoughts recently?
No, not at all.
Not at all. Okay.
I'm fine.
Okay. No thoughts that wishing you were dead?
No.
Okay.
No.
All right. How's your concentration?
What do you mean by that?
Like, if you're at work, I know you're working as an administrative assistant. Do you have any trouble doing your job tasks or, writing out memos or reading emails? Do you
The
have any
only
trouble?
trouble that I get recently with my job is just I have to pee all the time. Because
Okay.
I'm getting thirsty a lot, and I don't know if that's related to the medication.
Okay.
I believe so because Dr. March told me that one side effect would be the dry mouth.
Okay.
So I take more breaks because
Okay.
I have to go to the restroom all the time, and I'm constantly hungry,
Okay.
and I feel more fatigued.
Okay.
But not concentration problems. I wouldn't say that.
Okay. So what I'm hearing is since you've been on this Seroquel, and it's been about 3 months, you're hungrier and you've gained about 20 pounds. You're thirstier, and so you're drinking a lot more water, and you feel fatigued.
Yes.
Those are the negatives with the Seroquel.
Yes.
But on a positive side, you feel like your mood's been a little bit better.
Yes.
You haven't been depressed,
Yes.
and you're sleeping better.
Yes.
Okay. All right. Do you exercise at all, Abby?
No.
No. Okay.
I never find the time.
Okay. And I know you're eating more. Are you eating differently since you've been on this Seroquel? Are you craving any type of certain types of foods?
Not really.
No.
Not
Okay.
really. But if I didn't pack enough lunch and I get hungrier, and then I would have something from the cafeteria at the school.
Okay.
But
All right. right.
I didn't actually change my diet, just taking more,
Eating more.
eating more.
Okay. How often do you see Dr. March?
Monthly.
Monthly? Okay. So you've seen him within the past month and he's kept
Yes.
you on this Seroquel?
Yes.
Okay. All right. Do you have any questions for me right now?
I've been Googling
Okay.
everything and I'm afraid that this medication is messing up with my metabolism or something. And I really like this medication because I can sleep better now. But I'm afraid, does it really can cause diabetes?
And it can, and that's something that Dr. Timmons and I are going to talk about. We're going to talk about, a treatment plan for you and some labs that we want to have ordered for you, and then possibly talk about maybe getting in touch with Dr. March. We may need to do a medication change.
Okay.
But certainly, like you said, there are some positives with this Seroquel. But yes, Seroquel is one of the medications that can cause problems with blood sugar and elevation in cholesterol. So it is something that we are going to need to monitor. So let me touch base with Dr. Timmons,
Okay.
and then we will come back and talk about what we want you to do and what's the best way to handle your treatment at this point.
Okay.
Is that okay with you?
Yes.
Okay, thank you.
Thank you.
Hi again.
Hi.
Almost done today. Thanks for your patience.
Hi, Abby.
I had a chance to talk to Kirsten in the hall, and we talked about some things we each talked to you about. And she had mentioned to me that you were concerned about diabetes or high sugar, and that you looked that up on the internet.
Yes.
Yeah, well, you're a smart woman, because that is one of the things that I'm worried about today, okay? Along with some other things. Sometimes underactive thyroid can cause these problems. Sometimes sleep disorders and some other types of illnesses can cause these problems as well. So I want to start today by running a couple tests right in the office. I'm going to have a nurse come in, and she's going to do what's called an AccuCheck, where she's going to prick your finger to check your sugar so we can get a look at how your sugar looks today. And I'm also going to ask to get a urine sample today, because in the urine sample we can also look and see if there's sugar in the urine. And I just want to make sure that you're not pregnant. Okay, I know you told me that your periods are regular, but I think we're safer just to make sure.
Okay.
We can do those today, and we'll have those results back in the next few minutes. On top of that, I'm going to give you a prescription to get some blood work. And this blood work needs to be done fasting any day this week. And we're going to recheck some sugar and diabetes tests, some cholesterol tests, some thyroid tests. And when we get all this information back, we will get in touch with you and we'll put our plan together.
Good.
But most important thing is you're going to be okay, and we will work this out.
Good.
Okay, and Kirsten's going to talk to you a little bit about the medications and our plans in terms of your medication.
Yes, so as Dr. Timmons just said, we are certainly going to get these labs, and once we have the results, we will want to share them with Dr. March, because we all want to be on the same page here and make sure that this medication isn't causing issues with your blood sugar or your cholesterol. So in the interim, I do want you to continue the Seroquel as prescribed by Dr. March, taking that at night, the 300 milligrams. And once we get the labs, we will let him know and come up with a plan of care that's going to best meet your needs. If your blood sugar is elevated and your cholesterol is elevated, we may need to change the Seroquel, and that certainly will be discussed in conjunction with Dr. March. Okay, so for
Okay.
now, you certainly should keep taking it. The other thing that I wanted to talk with you briefly about is I had earlier asked about exercising, and right now you said that you're really not engaging in much physical activity. So another thing I would like to encourage is if you could add in a little bit of activity, even if it's just 1 or 2 days a week to get started. That will certainly maybe help your energy and weight, and will help prevent issues with cholesterol or diabetes in the future if you don't have a problem already. So do you think that's something that you'd be able to incorporate into your life right now?
Sure, yes. I can
I
try
know it's
that.
hard. It's hard. And people, I know you're busy and you're working. And even if you just start out on the weekends and just, maybe add in 20 minutes of walking 1 or 2 days a week and then build from there. But that's certainly something that is not going to hurt and can certainly only help.
Okay.
Okay. Another thing, I know you had told me that you're not having any suicidal thoughts right now.
No.
And you haven't had any recently. If you were to have any issues with suicidal thoughts, would you be able to reach out to either your counselor or Dr. March or certainly myself or Dr. Timmons?
Yes, I sure think so. Yes.
Okay.
Okay.
All right.
And thanks for offering the help.
Okay. Because certainly we ultimately want you to be safe and we want you to be healthy. So that's what we're going to work on as a team here. And we will be in touch shortly with the results of your labs.
Okay. Thank you so much.
Do you have any questions before we're done?
No, she answered my question. My question was if I should keep taking the medicine, and she already did.
Wonderful. Well, once again, we'll get this worked out and we'll be in touch soon.
Okay. Thank you so much.
Pleasure meeting you.
Thank you. Likewise.
It was nice meeting you.
Nice meeting you
Okay,
too.
thank you.
Thank you.